Let me begin by thanking my fellow panelists for their hard work, commitment, and wisdom. This has been a team effort with a distinguished and experienced group of panelists, and I'm pleased to say that all of our recommendations were supported unanimously by all panel members. The panel worked hard over the summer reviewing data from the Alberta government and KPMG and interviewing major departments. Our approach was strategic. We focused on the largest departments and the main cost drivers. Our main findings should be of concern to all Albertans. We found that without bold change, Albertans face a future of rising deficits and debt, with more and more tax dollars going to interest rather than programs. Delay will only worsen the problem. For instance, if the government of the day had frozen spending in 2016-17, the current deficit would be $3.2 billion less. We found that if Alberta's per capita spending matched the spending of the three other big provinces, Alberta would spend $10.4 billion less annually and would not have a deficit. Worse, while Alberta spends more, the results achieved are no better and in some cases worse than in other provinces. Raising taxes is not the answer. Alberta has a spending problem, and the government needs to act quickly and decisively to reduce its spending. But the province needs to go beyond merely cutting spending to transform the way that services and programs are delivered. Healthcare, which represents 42% of the budget, provides an excellent example of spending more but getting less. If Alberta spent the same per capita as comparable provinces, it would spend $3.6 billion less each year on healthcare. Closing the spending gap requires moving more service delivery from hospitals to community-based facilities, more fully utilizing the skills of healthcare professionals beyond doctors and registered nurses, and changing the way doctors are paid and the amount they receive. Some services, like day procedures, should be moved from hospitals to private clinics to reduce costs and enhance patient service. More generally, the panel found that current collective agreements contain provisions that make it difficult for the province to provide quality, timely services at a reasonable cost. Thus, the panel recommends that the government make more use of not-for-profit and private sector delivery of programs and services. K-12 education represents 17% of the budget, and spending in this area has grown faster than the relevant school-age population. The panel recommends that the government work with stakeholders to reduce the spending that goes to administration and governance. Also, the current funding formula should be changed to provide incentives for sharing services and achieving better student outcomes. In advanced education, which represents 11% of the budget, Alberta spends significantly more per student than comparable provinces, even though its participation rates are lower. The panel recommends that the government work with stakeholders to define the direction, the goals, and the appropriate governance for the sector. The panel also recommends that the government move to a revenue mix comparable to Ontario and British Columbia, where there is less reliance on government grants and more funding from alternative sources, including tuition. The province should also assess the financial viability of its 26 post-secondary institutions. In terms of the public sector, the panel believes that the public service needs to be renewed to enhance its capacity to be innovative and change-oriented. To support the attraction, engagement, and retention of qualified staff, the panel recommends that the management freeze on merit in-range increases be ended. Public sector compensation represents 55% of the budget. Public servants in Alberta have benefited from generous compensation and benefits, as well as job security during the recession. Thus, balancing the budget will necessitate restraint in the compensation and the size of the public sector. Capital spending is another major area in which Alberta's spending is well above other provinces. Alberta's net capital stock per capita is 44% above the national average. And capital grants to municipalities, which make up 1/4 of the provincial spending on capital, are much higher than in other provinces. Thus, the panel recommends that the province examine its framework for capital funding to municipalities to align the funding with provincial goals, require municipalities to share more of the costs of major projects, and to bring Alberta's per capita capital stock in line with comparable provinces. As well as making specific changes in key areas, the panel recommends that the government conduct a principles-based program review across all government agencies and departments to enhance the effectiveness and efficiency of government service delivery. Balancing the budget involves reducing spending, but also finding ways to grow and diversify the economy and enhance revenue. The panel found that Alberta has lost its competitive edge in attracting investment and is seen as being overregulated with lengthy processes and uncertain timelines. The panel recommends that the government work with industry and Albertans to develop a vision and strategy with clear, measurable targets to foster job and wealth creation, and to rebuild Alberta's reputation as the best and most responsible place to do business. The panel believes that if the government moves quickly and decisively to reduce spending, transform program and service delivery, and promote economic growth and diversification, the budget can be balanced by 2022-23. The panel also recommends that to maintain the province's hard-earned fiscal health, annual increases in total program spending should be limited to the projected rate of increase in total household incomes, and that in-year spending be restricted for funding for real emergencies, disasters, or totally unseen events. Also, after balancing the budget, the province should build a formal buffer for its revenue forecasts and introduce a legislated plan to eliminate its debt by 2043-44. The panel's recommendations represent an ambitious plan to balance the province's budget and sustain its long-term fiscal health. Implementing it will require difficult choices and bold action. Challenging decisions will be required, but once the budget is balanced, there will be opportunities to reduce taxes and invest in new programs. Thank you.